Good evening, Regis community. Welcome to the Spring 2021 Town Hall. We were saying before, this will be our last Town Hall of 2020. We've done so many over the course of the past 8 months, and we thank you for joining us tonight. I'm Walt Horner, I'm the Dean of Students at Regis, and today we're going to focus on our plan for the spring semester. And it's important for us to share some highlights for you and remind you that a lot of this detail, much of this detail is found on our website. We'll remind you of that throughout the town hall today. Our agenda for today is similar to other town halls. We're really going to focus on some key components that we want you to be aware of for the spring, including health and safety. We want to talk a lot about our commuter student experience because we have a number of graduate and undergraduate students that are going to be commuting to campus. Dr. Driscoll is going to talk about the academic experience and what that's going to look like for our students. And we've got some special folks that are going to talk about the residential experience and our community standards to make sure that we're safe. And as in other town halls, we're going to wrap up with a question and answer session for you to ask your questions. And as a reminder, you can submit those via the chat function. We already received upwards of 40 questions in advance. We're going to get through as many of those as we can. We're joined by a wonderful group of folks, a lot of familiar faces from past town halls. They're going to walk us through this important information. But I also wanted to highlight two special guests that are joining us today. Santi and Sir Jean are two of our wonderful student leaders, and they're joining us today to give us a student perspective. They've both been on campus since August, and they've got a really unique perspective that they're going to bring to us in our conversation today. So without further ado, I'm going to introduce three fantastic folks. Dan Leahy, the Director for the Center for Ministry and Service, as well as two alums and graduate students, Caron Camille and Christina Puccio, who are going to lead us in an opening reflection. Dan?
Thank you, Walt, and good evening, everyone. At Regis, it is our tradition, it is our custom to begin large gatherings such as this in prayer, asking for greater awareness of God's presence and for God's guidance. And so, as Walt mentioned, for that this evening, I reintroduce two of our fine, outstanding graduate students who also serve as interns. Caron Camille, the Center for Inclusive Excellence, and Christina Puccio, the Center for Student Engagement. And they will lead us in our prayer this evening.
Hello, everyone. First, I want to start by saying thank you for giving us the opportunity today. Before we start, Christina and I would like to thank you all for being here today and just want to say how grateful we are for giving the opportunity to represent the institution from the graduate level.
So with that, dear God, today we pray for the guidance and the strength to be able to share our institutional updates to the Regis community. We pray for clarification and assurance that the decisions made are understood by those who are affected. With that, we also want to extend our prayer to all of the students who are continuing their education during this time. God, grant them the strength to focus on their studies and get support where needed.
For those with mental health challenges who face isolated, anxious, and helpless, God provide them with the necessary support.
For all of those who are sick and infected, God, help to heal and sustain bodies and spirits, contain the spread of the infection.
And finally, for workers in various entities facing layoff, financial health hardness, God seek them from panic and inspire your church to genuinely support them. Amen.
Amen. Thank you, Caron, and thank you, Christina. Great job. Thank you very much. It is now my privilege to introduce our next speaker, President Hayes.
Thank you, Dan. And thank you for that wonderful prayer. It was wonderful to hear from you and from our graduate students. Well, first of all, I just want you to know how excited I am to see you today, because we're going to talk to you about our repopulation and our spring semester plans. And I just can't wait to see you back on campus this spring. It has been a very lonely time over the last 9 months. And while we've had some students living on campus, the fact that we are opening campus to all of you to be able to return to classes, some of you will be living on campus, but that we will be able to welcome all of our undergraduate students and our graduate students And I just wanted to take this opportunity to welcome undergraduate, graduate students, and the parents of our graduate students and faculty and staff who have joined us today. This evening, we have welcomed over 170 people to this evening's webinar. And I'm just really, really excited to see you. So we have lots to talk about. We have lots to talk about in terms of testing and the residential parts of our community and what we learned this semester. Well, even though we had a smaller number of students on campus, we learned a lot. And we also watched other higher ed institutions, and we learned a lot from what they did, both good and not always so good. So we are ready and waiting for you. And again, there's a lot to learn tonight and a lot for you to hear about. But again, I cannot say how much I have missed all of you and how excited we all are to welcome you back to campus. So I'll let the rest of the group talk to you, and I will be here to answer any questions that you might have regarding our reopening of campus in the spring. So I'm going to now pass the baton to Dr. Kara Kolomitz, COO and Senior Vice President.
Thank you, Tony. Good evening, everyone. It's nice to be with you this evening. This evening, we're going to share with you some general overview of our process for the repopulation to campus. We're going to have some student speakers that are going to detail their experience and what will soon be your experience. And we will often refer you to our very robust website and our FAQs that will answer more fully for you in very fine detail all of the intricacies and the logistics of our repopulating plan. It's been my pleasure and a true honor through the summer and this semester to lead the COVID-19 repopulation to campus working group. This working group has comprised of varied university leadership, faculty, and staff, and we meet on a daily basis, constantly monitoring the coronavirus, in regular contact with state, local, and federal health officials and authorities, and all of the decisions that we have made regarding our current campus use and our future campus use. The repopulation is based on pure science and pure scientific facts and best practice as guided by, again, the local Board of Health and the CDC. The faculty and staff have worked so incredibly hard to ensure that more students can come to campus at all levels next semester, our doctoral, our graduate, and our undergraduate students, and have the robust academic experience that I know you're so excited to begin. Our top priorities at Regis continue to be the health and safety of all Regis constituencies. Again, faculty, staff, and students. Our COVID-19 protocols this fall have been very successful, and as President Hayes said, we have learned what works. We are proud of the few positive cases on campus this semester, a very low positivity rate, the robust contact tracing that we have in place, and that we have not experienced any community spread on campus this semester. So that puts us to looking forward to our January repopulating plan. The working group this past semester had a very significant charge. It was to ensure a robust testing protocol, to establish safe classroom standards, adherence, of course, to all CDC and state guidelines, strong public health policy and practice appropriate for a campus setting, and figuring out how to offer the appropriate modalities for all of our individual students. So tonight, I'll summarize those key points and again, continue to refer you to our website and the FAQs. As we focus on the health and safety of all of our students, our residential students, and all of the non-residential students that will be commuting to campus, I encourage you to use the chat function for any of your questions that you may have. And of course, please remember to refer again to the FAQs on the website. We're going to continue to talk a little bit about the rationale for our return to campus. We worked throughout the semester to establish a very robust testing protocol. That robust testing protocol is in place. And I know that many parents have asked us about a potential delayed opening to campus, and that is not something that the institution is considering. Our testing protocol, our contact tracing, our safe classroom standards, our good public health policy, it is all in place. It is ready at any point for us to repopulate the campus. And we don't anticipate that there will be any delay unless there is a public health declaration that our institution needs to delay. Otherwise, we are opening on time as slated in January. We want to, again, welcome back all of the students, those students that will be commuting to campus for their in-person academic experience, those students that may be living on campus and having an in-person experience, those students that are remaining virtual, and those students that will be virtual and also coming to campus. We frequently say at Regis, the best way to experience being at Regis is through the students' eyes. We're so pleased that Sir Jean and Asante are with us this evening. So now I'd like to introduce to you our Assistant Dean of Students, Annabella Morbito, who will more fully go over some of the student life experiences and implications. Annabella?
Thank you, Dr. Kolometz. I'm very excited to be sharing the screen today with Sir Jean Delma. She is such an important presence on our campus, and I'm excited to have this conversation with her. So let me give her an opportunity to introduce herself and tell us all that she does on campus and why she's so important and vital to our community.
Thank you, Annabella. My name is Regis Delma, and I'm a senior nursing student. I serve as a resident assistant, and in that role, I've lived on campus this past fall semester. I'm also the vice president of Student Government Association, and I've been part of the conversations with administration throughout the summer and the fall to ensure that the student voice is central to the planning process.
Well, thank you, Sir Jean. I'm excited that we get a chance to talk about health and safety and life on campus. I think especially you as a nursing student, but even more so because you personally lived through this. And I think you have a lot to offer to the conversation. So let us dive in with my first question. Can you tell me a little bit about your experience with the health and safety protocols on campus?
Of course. So all of the students that will be coming on campus, residents and commuters, graduate and undergraduate, will be part of a testing protocol. They will be asked to do an online tutorial and do the Regis Pride Pledge. I've done that. And we'll be able to schedule our weekly COVID testing appointments. And those results will be available in 24 hours, which is really fast. And we'll be getting the results via emails. And if it is a positive result, it will be a phone call. So one thing that we did while we were on campus was monitoring our symptoms every day before we even walk out of our rooms. We always were mindful of wearing our mask and social distance ourselves. And when I say wearing our mask, I mean everywhere. I mean the bathroom, I mean the gym, I mean the halls outside, the laundry room, the classrooms, right? And another very important thing that I did and everybody else did was being mindful of our behavior off campus too. So of course we are allowed to leave campus and visit our families. but we have to be mindful of how we behave off campus. And as nursing students, we usually work in hospitals. So one thing that I would do was make sure to take a shower before even going to the cafeteria, for example, washing my hands, or not interact with anybody else after coming from a shift at the hospital. And I speak also for all seniors right now when I say that I just want to graduate in peace. So I would really like if everyone just, follow the protocol. We just want to be safe, but also enjoy your last semester here. So, yeah.
Thank you, Sergine. We couldn't have said it better. And I just want to do a reminder. This applies to all our graduate and undergraduate students, all our students who are commuters and residents alike. If you are in those groups, you are in the testing protocol, and you will be getting an email with information on how to complete the online tutorial, how to complete the Regis pledge, and test your appointments, which you can do at your own availability, as long as you do it weekly. Once that you receive that information, just make sure you follow up, because it's crucial that you do that before you come to campus. But I think a lot of what Sergine shared is so important, and I echo the sentiment. I think we all just want to be on campus and be with each other and be in peace and be safe. So thank you, Sergine. That all sounds awesome, and it sounds like we're going to have a safe campus experience if we follow these protocols. But I also want to talk about the possibility of also making this experience enjoyable. We're still a community. We still want to be with each other in a way that is safe. So can you tell me a little bit about what life on campus was like, and what residents and commuters can expect, not only in terms of programs, but also spaces that they can use?
Yes, of course. So Regis is still our community. It's still our home, and we still have events and programs. I know the Res Life staff has been working really hard. So has the Center for Student Engagement. And SGA is also very active and will remain a central voice in plannings. Campus spaces are available to residents. One thing that I've used a lot with my friends was the computer labs for study groups, classrooms, libraries, lounging spaces, CMS, CSC, like inclusive excellence. The chapel will be open for prayer and meditation. The LSC, we have pool tables, we have ping pong tables. And another thing that I've also used was the res hall lounges with other residents to watch a bachelorette, and like in small groups. And there's always signage throughout the campus that explains the capacity limits and what the rules are for that particular space. So I always encourage like students to just enjoy and have fun. Just go to the quad and sit on the chair and have a nice day. When it's nice out, go out in the field for a workout. Or another thing that I love doing was just walk around campus. I call it my worship walks. I would just listen to music and just walk around. I just think mental health is very important. So it's gonna be still our community that we love. We just have to make sure that we enjoy ourselves and we make it, home.
Thank you, Sergine. Yeah, I think it's so important to remember that we still are a community, and every event that we're planning, we're doing so with safety protocols in mind first. I also want to share that our Department of Athletics is establishing a plan to safely open the pool and to safely open the fitness centers, along with just meaningful athletic opportunities that will be available to students. So there's a lot that we're working on, that we're doing so mindful by the guidance of course, experts, public health experts. So if you have any questions about campus spaces, hours of operation, safety protocols in general, I would encourage you to check out the website under the COVID-19 section. The campus spaces section tab has really helpful information about every campus space, along with the health and safety protocols and the FAQs. There's so much you can explore on the website, and I encourage you to go and check it out. I also encourage you to peruse the calendar. We have uploaded some of the events that we'll be having on the spring, although not all, because we have a lot of clubs that will be hosting events, and we'll be populating it as in the future. So make sure you do that. If you have any questions about the sort of the student experience from an engagement point of view, don't be afraid to reach out to me and to our team in the Center for Student Engagement, and just follow us on social media at Regis CSC and Regis Life so you can stay connected with what we're doing. Of course, we're offering in-person events, virtual events, and hybrid events to accommodate for our community. But before I turn it over to Dr. Mary Driscoll, I would like to just thank Sir Jean. I think your perspective is invaluable as we think about coming back to campus, and you've lived it, so you have a lot of wisdom to offer. Thank you, Sir Jean.
Thank
And
you.
I would now like to introduce Dr. Mary Arena Driscoll, who will talk us through the academic experience. Mary?
Good evening. It's my pleasure to talk with you a little bit about what your academic life is going to be like. And I want to reiterate what everyone has said. We are ready for you. We are waiting for you to come. And that's whether you're a graduate student or undergraduate student in one of the many different modalities that we're talking about. So first of all, as our previous speakers have said, we've already had students learning on campus and living on campus. And we've learned a lot about how to do that safely, how to set up classrooms, what we need to do differently in classrooms in fields where students can't socially distance, as in some of our health fields in terms of protective gear, and what it means to look at classroom spaces that need to be socially distanced. It looks very different, but we are ready and we are prepared. And as you just saw in some of those slides, we have lots of signage to remind you what the protocols are. One of the things that we've learned, not only from our own experience, but also from the experiences of other colleges, is that COVID has only rarely been spread in classrooms. That is, in the classroom interaction and the academic interaction that people who come to campus and people who are living on campus have. Observing those protocols really does work. It really keeps people safe. Just as observing all of those protocols keeps people safe around the campus and living on campus. So we want to provide that reassurance for you and underscore how central that testing protocol is to keeping our community safe. We've already done a lot of work to get ready for you and to get ready for the academic experience. As you know, we were not able to invite all undergraduates to campus. Let me say for a moment that for graduate students, many of you, if you're with us tonight, who are always online, your life won't look very different than it has this semester. For our on-the-ground programs, you have already heard from your program directors if there are any changes in start dates for you and what that's going to look like. But we've had our occupational therapy graduate program on campus already, so we have experience with graduates being here. But for undergraduates, as you know, we were not able to provide housing experience for all students because of the protocols that required us to safely house students using only single rooms. The work that we did was based on looking at making sure that students had the greatest chance to make academic progress this semester, just as we've thought about that and worried about that all year. And as you know, there are some majors that require in-person, sometimes clinical, but not always, experiences in order for students to make full progress this semester. So we invited to campus those students first, along with the remaining seniors who were not in those majors because this is their last chance to be on campus. As you know, we then moved to first-year students and then to students who would find it more difficult to commute because of they're out of state, and then on to other students who didn't fit in any of those categories. We've now moved through all of those categories and people have had a chance to think about living on campus or making plans to commute because everybody's invited to campus. And I know that the housing stock right now is full with a wait list. So we're very pleased about that and the people have been thoughtful. You also know that when you registered, and I hope you have registered by now, on the registration, it told you whether the class would be in person or whether it would be synchronous or asynchronous remote. So you know what your schedule looks like. But it doesn't stop there. You came to Regis because you wanted a personal touch, because you wanted to be able to talk to faculty and to advising staff and to academic support people and coaches about what were your plans for this semester. And many of you have continued very wisely to do that. And in some cases indicate if you believe you have special circumstances that will make it particularly difficult for you to come to campus. All of the students who have previously not been residents, who have not been commuters, who were in residence before, were contacted this past week by our academic support and advising staff, and you had a chance to register some of the concerns that you had or issues about particular classes. I want to tell you tonight that your deans will be reaching out to you this week to tell you to hang in there. We are starting to work through all of those special requests individually, and that we believe that we will be able to have everyone make the academic progress that they need. I can't promise you your schedule is going to look exactly the way it does now, but I can promise you that next week, the academic advisors and faculty advisors will be working on an individual basis to ensure your success. In some cases, for students who have special circumstances that they can't come to campus, it may mean taking a different version of a class or a different class. But we are also going to enable the possibility of students to attend via Zoom the in-person classes that are being held on campus. So you'll be hearing more about that now, but your faculty advisors will work to finalize your schedule so that you should know, certainly within the next 2 weeks, exactly what you're going to be doing. And you can be confident that you will be able to continue your registration as a student. Our classrooms are socially distanced. As I mentioned, they look different. They're going to be set up also to make sure that we facilitate students' ability in those occasions where we do have to have people attend via Zoom and in-person class. We also have realized that we're going to have students on campus who will need a space in between in-person classes, perhaps to attend a class that they are taking remotely, or time to study, or to work on projects. You're going to need spaces to perch, which is what I've been calling it, meaning a space that you can just stop temporarily and find the kind of quiet and time that you need to do those kinds of work if you do not have a resident space on campus. And so we're identifying those spaces. We're making sure that they will be maintained with healthy protocols. And I believe a list of them are even up right now on our website so that you can begin to envision what it means to be a commuter on a campus where you do not have a residence, a room, and all of the ways that we're going to facilitate building the best life for you while you are here. All of the academic services that you've come to know will be in full swing, but we will have both remote and in-person ways to access them. Your ability to talk to your faculty advisors will still be facilitated remotely, although some faculty may choose to also offer the option of in-person office hours, again, in a socially distanced space, which may or may not be their office. We want to emphasize, and Dr. Buonaconti is probably going to talk a little bit about this, this only works if we all fulfill the same expectations for behavior and conduct, and that includes in the classroom. So the classroom will be a mask space, and we'll have certain expectations about what that means in terms of students' compliance with our protocols. But we know you're ready to be back, and if this is what it takes, you're ready to do that too. The last thing I want to say is we have some opportunities for some work-study positions. And I know for many of you that's been a concern because we had fewer positions perhaps this semester. We're going to need students who are going to be assistants in hybrid classes that have some students Zooming to facilitate that and work with the instructor. And we'll provide training for that. We're also going to need some students who will help us work and monitor those spaces that are not classroom spaces where students are, again, to use my word, perching. And so we'll be sending out descriptions of those next week, and you'll be able to apply for them. The one thing I will tell you is if you're working in a class to assist with online, the Zoom sessions, it cannot be a class you're taking if it's work study. So we'll have to assign you or make available the opportunities once you decide that this is something you want to try. Once again, and I've said this at many town halls, I'm really looking forward to meeting many more of you in person. So with that, I'm going to turn this over to Dr. Bridget Buonaconti, our Assistant Dean for Student Affairs and the Director of Residence Life. Bridget?
Thank you so much, Dr. Driscoll. I'm excited to talk a little bit about the residential experience and some community expectations, but most importantly, I'm really excited that I am joined by Santiago Pedraza Novak, who has been with us on campus through a lot of this pandemic, and he offers such a wonderful insight to us. So Santi is a sophomore biology pre-med major. He's also a member of the men's soccer team. He's also an RA, and he fulfills many leadership positions and always is so gracious when we ask him to join us and help us out. So I'm thrilled that he'll be joining me to answer some questions and give you better insight than I ever could into what it's really like on campus. As Dr. Driscoll mentioned, you've seen the residential plan. You've heard a lot about the residential plan. You might be sick of hearing about the residential plan, but we do want to talk about it just for a minute. So we spent time inviting groups to campus, and now that we've gone through all three groups, if you were someone who was residential and weren't included in one of those groups, you've also gotten an email from me that says, we would really appreciate knowing if you'd like to be on our wait list, because things change all the time. Student decisions may change all the time. And we want to make sure that we're offering the most amount of opportunities to as many students as we possibly can. So if you're wondering, or if you said no to your opportunity and you were in group 1, 2, or 3, please know that there is a wait list, and I am happy to work with you on that. So that's one of the things. If you're looking for a lot of information, and there's a lot of information about this plan, I encourage you to go to the COVID-19 section of our website. There is a spring residential plan section. It has FAQs. It has the link to the town hall that we did just about residential students. So we really want to spend time making sure that we're talking about your experience and less about the plan. So I'm going to ask Santi, you've spent time with us on campus since the pandemic started. Can you share with students a little bit about what to expect, not in the halls, but also on campus, because we keep telling them it'll feel a little bit different?
Absolutely. Well, first of all, good night to everyone. Thank you for joining us here. To kind of answer your question, I would have to say that yes, things do look a little different. Things will feel a little different at first. And like everything in life, we do need to adapt. Obviously, both inside your residential hall and just walking around campus, you'll find, the different things that the school has adapted. The first one that you'll notice will probably be the 1,000 dispensers of hand sanitizer that we have all inside and outside, as well with any doors that you might need to encounter in College Hall, Maria Hall, Angela, wherever you might be. There will be a way for you to open the door without physically touching the handle with your hand. As well, inside the residential dorm, know that you will live in a single, you will have your own room, you will have your own space. As well, we do need to abide to our no guest policy on campus. You are not allowed to bring any person who is not a resident at Regis. They are not allowed to enter any residential dorms. Know that the bathrooms, obviously they'll still be communal, but they're all going to be clean daily. We did a great job during the fall in maintaining all these spaces as clean as possible as a student body. And as well, know that you will be, like Sir Jean mentioned, attending your weekly test, and as well in the cafeteria and in the different spaces at school, you are expected to abide to any follow any social distancing guidelines that the school and the state has imposed.
Thank you so much, Santi. Our residents did a great job this fall, and it's why we could be so confident about bringing more students onto campus in the spring. And we are, as everyone has shared with you, so excited to see more students on campus, to see more life to our campus. And so I want just to mention move-in very briefly. We will be continuing the process that we started in August with move-in, with a staggered move-in. So it won't feel, if you've been to campus before and you've moved in, that fanfare, everyone all together all the time. It'll feel a little bit different, as things often do now. We're going to stagger your move-in. And that's for a few reasons. It's one, so you can get that initial test when you come to campus, which is essential for us. It's two, to make sure that we are limiting the amount of people in lobbies and on floors and in hallways. It's to make sure that you can feel really good and settled and not feel rushed. So you'll get an assigned move-in time. For those students who are traveling to us from out of state and we know that you need to make travel plans, we have said that your move-in date is January 12th. If you need to work with me, you always know, work with me. Let's figure out the best way and the safest way to get you to campus. You're also going to see that we have gotten a lot more of those moving bins that you love, and we're going to make sure that we're wiping them down after every use. So we've learned so much from the August move-in, and you'll get a lot more information, hopefully this week. Hopefully that information will also include your housing assignments for spring. And I want to thank you all in advance for the many emails and the flexibility that you showed when you said, my roommate will be keeping our room, I'm willing to be reassigned. That's a hard decision. But we know inside of that decision that you understand that it's a real privilege to be one of the 400 who are able to come to campus. So I thank you for your flexibility, and I'm going to ask for your patience when maybe you don't love exactly the room that you were assigned to. But we're excited about spring. So Santi, I really want to ask you, you've been here for so long and so many things have been closed. What are you excited about seeing reopen in the spring on campus?
Yeah, this is honestly one of our best parts about the spring plan is that we'll have spaces like the library that are going to be available to us again. We'll have athletic complexes like the gym and the pool reopened again. Obviously, we're still trying to figure out the restrictions of how the times are going to look, but know that those spaces will be there for us. Probably for me, the biggest one will be the gym in College Hall. That'll be open for us again, for us to get our workouts done, not specifically in the Maria and the Angela dorm, which will also be open for us to use. Going kind of, moving in that athletic direction, I do want to ask you as a student athlete, what are some updates or what have we heard about what athletics would look like on campus during the spring?
Yeah, it's only fair, right? I've asked you a million questions, you get to ask me one. We know our athletes are so anxious to return to their competition, and we as spectators, myself included, are so anxious to see you back on campus and doing the thing that you love. For many of our student athletes, you got an email yesterday explaining an update that was given by the GNAC. And what the GNAC decided is that fall sports will not have competition in the spring, except if there are championships for that sport in the spring. They've also announced that they won't be able to make a decision on spring competition until February. But that doesn't mean at Regis that we aren't committed to your athletic success and your athletic development. And so when we get to Q&As, I know Dean Horner is absolutely going to ask Mark Clemente about what meaningful athletic engagement is going to look like, what our student athletes can expect no matter if they're competing or not, and how they'll be able to connect as a team and grow athletically. So Santi, I'm so sorry about your soccer season, and for all the fall athletes, we know that you wanted to compete more than anything, and we wanted to see that. We hope that the things that we are able to do will encourage you to remain a member of the Pride with us. I want to move to community standards, which is everyone's favorite topic, and at about 7:40 at night is exactly what you want to be hearing about, but it's incredibly important. We've heard so much about what's going to happen on campus and the exciting things that come with it, but we need to know how to protect the Pride. And so we're going to continue the conversation that so many have had before us. And what I want to say as Chief Conduct Officer is, whether or not you ever knew it, the protocols and the policies that we have in place have always been about your health and safety. And these are absolutely no different. Every piece that we have put in place, every restriction that we're going to ask of you, everything that you're going to do is about health and safety. And we can't do it alone. It can't be me. It can't just be the people who are speaking to you on the screen. So Santi, you've been here and you did so well, as we heard from Dr. Kolomitz. There were so few positives. There was no community spread. How did you go about doing that? And how did you encourage all students to be partners with us in that health and safety?
Obviously, being an RA allowed me to have a position where I could influence people in the dorm. But I do gotta say that it was not up to me or the other RAs. I do gotta say that what guaranteed our success during the fall and what I know will guarantee our success during the spring was our community. We were able to establish a culture where we all were, one, very, very aware of the fact that we're very lucky and fortunate to be on campus studying right now, given the circumstances. And also, we were able to understand that our actions now more than ever not only affect us, but affect everyone else. So it was good to see that not only students with our leadership position, but also students that were there as residents were able to establish the culture themselves of knowing that you have to wear a mask if you're going to the bathroom that's 10 steps away from your dorm. You have to wear a mask if you're in the gym. You have to wear a mask if you're in the lounge with 3 other people. So creating that culture and their awareness that we're all in it together, and if we all pull towards the same way, we'll be successful. That is what guaranteed us to stay on campus for the fall, more so than, you know, having the RA reminding you to put on your mask, to stay social distance. So I think that moving forward to the spring, what we really need to focus on is bringing up the essence of what the Regis culture is, which at the end of the day is a family. We do got to stick together. We do got to pull towards the same way, and be very grateful for the fact that we'll be able to be on campus taking in-person classes.
Thank you. As Santi just explained, everyone, students, faculty, and staff need to be part of this solution for us to be able to remain on campus. And there are some things that we're going to ask specifically our students to think about when they are returning to our campus. And so those are listed in your residential contract, those are listed in the student handbook, but I want to bring up a couple that we get questions a lot before we head into this Q&A. One is, can I leave campus? And as Sir Jean beautifully said, yes, of course you can leave campus. Leave campus when you need to, if that's for a job, if your family is your support structure and that is going to get you through this challenging semester, wonderful. But if you are doing that, we assume that your behavior off campus is the same as it would be on campus, that you're wearing a mask, that you're socially distancing, and when you're walking into a place that you think this isn't going to go well, that you're exiting that environment, because it's not just about you, it's about everyone else. And the only way that we're going to, as my new favorite phrase is, make it to May, is if we do that together. So some of those things are not having guests. And that even means our commuter friends and the folks that are in the testing protocol won't be allowed to be in the residence halls. That means that if you're a resident and you live in a non-suite area, that your occupancy in your room is 2, including yourself. That if you're in a suite, your occupancy is 8, including yourself. We're trying to make this as reasonable as possible, and we want you to work with us on this. But if you can't, and if your behavior brings us to the point where you are endangering our entire community, you will be asked to leave our community, and most likely that will be not returning to campus as a residential student. That's harsh, and you generally don't hear us be this harsh. But we want you to know what's at stake, and we want you to know before you ever have to make that decision what we're asking of you. I thank you in advance for your ability to protect the pride. I thank you, Santi, for your words and the way that you are leading. And now I'm going to turn it over to Dean Horner, who I believe will start our Q&A.
Thank you, Bridget, and a special thanks to Sir Jean and Santi. You're what makes us proud. It makes the pride, right? Everything I think that you articulated tonight was so important for, I think, us to hear, because it's coming from a perspective of 2 students who have been on campus, who've experienced this, and have really sacrificed a lot to be on campus. It's not easy. It's for this students this fall, it's been an isolating experience. There is community, as Santi said, but it's been a lot different. And our hope in the spring, as Bridget said, is to really build our community back to what it's been historically with 400 residents and our commuter students as well. So thanks again, Santi and Sir Jean, for your time tonight. And wanted to switch over to some questions that have come in. As with all of our town halls, we get some fantastic questions. So I'm going to dive right in. I'm going to go through about a number of questions that came in prior to the town hall. These were submitted on our online form. And then we've also received a number of great questions in the moment. We're going to give ourselves about 15 or so minutes to get through as many as we can. We don't want to be on here too long because I know we've got other things to do than be on Zoom again. But no, if you submit a question as in past town halls and it's not responded to here, we will make sure that someone from our staff responds to your question specifically and shoots you an email or reaches out to you via phone to answer your question. If that's not the case, please, as in always, send an email to the COVID-19 email address, which you can see up on your screen, or feel free to call our hotline and submit your question. We'll get back to you as soon as we can. So the first question is going to be for Dr. Kolowitz, and this is something she addressed a bit, but I think we just want to be really clear about this idea that if Kara, if there's anything pandemic related that would cause Regis to suddenly pivot and move fully remote in the spring, I think there's concern when we're looking at other campuses and what they're doing, and talk a little bit about why we're so confident in our plan for the spring and if anything would change that plan.
Okay, I'm happy to do that. Thank you, Walt. There are some steps and factors that we put in place to really help to mitigate our community spread, which is one of the ways that campuses across the country have come to the conclusion that they need to close. And to prevent the community spread, we are housing only in single rooms. We are testing on a weekly basis with the ability to increase the frequency of testing at any point in time. We are also maintaining our own robust contact tracing program. And we have added into our testing protocol, not just our residential students, anyone on our campus is in our testing protocol. Faculty, staff, and students at all levels, our doctoral students, graduate students, and our undergraduate students. Those are all really, truly best practice. Those are the ways to mitigate spread, to understand asymptomatic carriers, and to reduce the spread by understanding who is carrying the virus. Those are all steps that, when put in place, have proven to be efficacious. And I would also say the other steps that we have in place are the ability for partial classrooms to be remote while some classrooms are in person, and understanding all of our public health practice and policy that we're insisting upon within our campus. Everything that Sante and Bridget referred to earlier is certainly part of the overarching plan for the entire institution, which provides quite a bit of confidence. And again, remembering that it is the plan that everyone is going to be bound by and will need to adhere to.
Thanks, Kara. I want to put Michael O'Keefe on the hook here for the next few questions. And we've heard this from a number of students and families, specific our residential students, but also our commuter students who are going to need a chance to get some food and a cup of coffee. So Michael, can you talk a little more about the dining plan for the spring semester? Specifically, there's questions also about Dunkin' Donuts in the spring. The important stuff, right?
Yep, sure, Walt. So for the spring semester, we'll have the main dining hall that's in the student center, that'll be open. The lower student center cafe will be open, and the bistro in College Hall on the second floor will be open. However, Dunkin' Donuts will not be open in the spring. So I'm sure, I know many of you might be disappointed to hear that, and that having a cup of coffee or tea is important as you're rushing off campus for clinical, or you're looking for an early morning bite to eat. So we are making some adjustments to compensate for that. The dining hall will be open an hour earlier than last year. That will help anybody with a meal plan make better use of your meal plan. And we're also offering something new and exciting for the spring. So it's an app for your phone from which you can order at the lower student center cafe, and it's called Dining Sidekick app. And it works very much like the other food ordering apps that you may be familiar with, Uber Eats, Grubhub, and things like that. So it'll do a couple of things. It'll allow you to order your food on the app. It'll allow you to pay for the app, and it'll also tell you when you can pick up your food. So we think that's a great convenience, but it's also part of our health and safety strategy. So a place like the LSC could get crowded in the evening. So we know that we can help reduce the amount of time you spend there, and you can reduce the interaction with the staff. So we're doing many things under the health and safety protocol. And we know that's something that the students also wanted, and we are having this semester, are meal exchanges. So you'll be able to, if you have a dining meal plan, you'll be able to use a dining meal swipe at the LSC for a series of pre-selected meal options. So simple, you'll either tap or order on the app, and you'll be able to use your meal exchange downstairs if you don't want to go up to the dining hall. So although Dunkin' Donuts won't be open, we think we've taken some other steps to help boost and improve the dining program for the spring semester.
Thanks, Michael. And as a reminder to folks, a lot of the hours of operation, a lot of this information and details on the COVID-19 website. The second question we've got for you is around transportation. We've got a number of questions from students that are going to be commuters, some new commuters, about the shuttle and other transportation and parking options. So we could just quickly talk about the shuttle and where they can find more information about the shuttle, and then a little bit about how to obtain a parking pass and a few things like that.
Sure. So the shuttle will be running in the spring. We're going to make some minor modifications to the schedule, but it's going to be very, very close to the schedule we had last spring. The biggest impact to the shuttle is capacity, and that's really due to the pandemic. It's the social distancing aspect of it. But we've worked with our shuttle vendor, and the capacity that the shuttle can now handle is very much in line with and exceeds our regular ridership on almost all of our trips. So we feel comfortable that the shuttle will get folks back and forth to where they need to be, either commuting to school or needing to get off campus to go to Market Basket to pick up food or anything else you need, or even out to the mall, because those trips will still be on the schedule. And the second item is the parking permit. So this is important. So anybody that brings a car to campus needs to have a parking permit. So we've got a couple of categories that you could be in. You could have been a student who in the fall had requested and received a resident parking permit. We need you to have that on the car. If you're commuting, we also want you to apply for that permit, and we want you to apply for it as early as you can. So the site is up and available. If you search the website for campus parking permits, it'll take you to a location where you input your information, and then Campus Police is working with Residence Life to have permits available for residents when they move in, and Campus Police is developing an appropriate strategy to distribute those permits to commuter students. So I would encourage everybody that is bringing a car, resident or commuter, do that as soon as you can.
Thanks, Michael. Bridget referenced this in Santi's fantastic question about the spring athletics season and what athletics is going to look like on campus. And this is for Mark Clemente, and it's specifically to discuss, so for our student athletes on the call can learn a bit more about what it means to participate in a meaningful athletic engagement during the spring semester. What's that look like, Mark? Can you describe that in a little more detail?
Yeah, and we've heard from everyone about the announcement that went out, and we also know that it's really difficult to conduct this outside competition. And I've sent the message out to our fall and spring athletes. We know that there's a lot yet to be determined, but let's be clear. Despite the lack of outside competition, our athletic program is going to be very intensive. We expect all of our head coaches to return at some point in January, and together we're going to be committed to providing this meaningful and engaging athletic activity. So what does that mean? Well, regardless of when the outside competition starts, our teams are going to be prepared. The period of uncertainty really gives our student athletes a chance to get faster, to get more powerful, and to get increasingly skilled. So the way we see it, it's an opportunity to have one-on-one individual workouts, then move into pods where we can have small groups and develop our skill work and then also have an intensive strength and conditioning program.
Excellent.
Beyond that, though, I also want to mention, though, our facilities are our advantage. So we want to make sure that we have the opportunity to use them, and as long as it's safe and within the governor's protocols, we plan to use them and get the best experience we can for our student athletes.
Thanks, Mark. And I think, as Mark said, additional information is going to come forth when it comes to the athletic competitions and the opportunities for other recreation athletic opportunities on campus. And that's one thing that we've really worked closely with our Student Government Association and student athletes to really build this out. And I think we all need to thank Mark, Pam, and the athletic staff on developing what we think will be a really robust opportunity in the spring. I'm going to switch here a little bit, and we're going to put Laura Burke on the line here for a question that's come through. And this is recent because of some of the recent announcements, and it's specific to the vaccine and the eligibility of students for the vaccine, and specific to our clinical students. Are they going to be part of the phase 1 vaccinations? And can you talk to us some about that? I know we don't know everything, but there's a lot of questions about vaccines for obvious reasons.
Yeah, good evening. So we're very excited that there are so many vaccines coming through right now, and the FDA is in the process of reviewing them and approving them for use in the United States. We do not have information at this time. The governor spoke earlier today, and he gave some outlines as to what the phases would be for release. We don't know at this moment where students will fall in this phased approach that they have. Dean Welsh and I have been in contact with the hospitals to reach out and find out where we are. We haven't heard anything yet. As soon as we hear back, we will communicate or best we can, but as right now, we do not know the process for vaccinating the student population. It is going to start with those who are at greatest risk, and then it will proceed from there. So when we have information, we will provide it.
Excellent. I'm going to keep you on the hook for a question that we just received, and I think it's important for students to understand in terms of the testing protocol and the differences between those in the testing protocol and outside of the testing protocol. So the question was from a student who's planning to be remote about their ability to come to campus and attend events and see their friends. And obviously, you know that as an epidemiologist, you can explain to us why we can't allow that.
I'm sorry, you're not going to be allowed to do that at this time. The whole goal of the testing protocol is to create a baseline safe population, to provide surveillance testing, to screen the population, and as quickly as possible, identify anyone who is exposed, who has the disease, and remove them from the population, put them into isolation, and to prevent the spread, community spread of the disease on our campus. So we want to maintain that population the best we can. So we're going to have the weekly testing of those who are on campus. So if you're commuting, if you're living on campus, if you're a faculty member, you're going to be tested every single week. And we're going to have that in place. You can't come on the campus just to visit your friends at this time. I'm sorry. It ruins all of our protocols. And testing is just one piece of it, just so we're all clear on this. Testing is just one piece of the protocols we have in place on campus. We've talked about it. Bridget's mentioned it, I think, 4 times so far. Other students have talked about it as well, but we're going to talk about the contact tracing. We also have the mask wearing and the social distancing. And one last thing just to keep in mind, being tested doesn't mean you're free from disease for the week afterwards. It means you're free of disease at the time you are tested. And just to keep that in mind as you go around, wearing that mask, socially distancing, hand washing are all just really important parts of this process.
Thank you, Dr. Burke. We've got a few more questions here I want to get to before we wrap up. And I know there's a ton more questions that we're not going to be able to get to tonight, but this connects to the testing piece and also to move into Bridget. And this is specific for out-of-state students in terms of their process when it comes to the testing protocol and arrival on campus. What's that going to look like if I'm an out-of-state student arriving on campus for move-in? What are my requirements when it comes to testing?
Great question. We're finalizing those for spring, but I'll tell you what we did for fall, and what we did for fall was very successful. So if you were a student who was from a high-risk state, which right now I believe is every state but Hawaii, and I don't know about Hawaii anymore, that means that you would come with a negative COVID test. If you weren't able to do that, you would, for fall, we had you test on campus and quarantine until your test results. We're going to at least ask that in spring. They say, come with a negative test. You're also going to be tested as soon as you get to campus. And our decision right now is, will you also need to quarantine if you have that negative test, or will you not need to quarantine? And we will have that exact information for you very soon.
Excellent. Thank you, Bridget. I'm going to take 2 more questions. And as a reminder, please do continue to submit. We're recording all the questions. You can either do it via email, via the Zoom chat, or via the phone line. And we'll make sure we get back to you, because I know there's a ton of questions that we're not going to be able to get to in the course of the session tonight. In this next one is an important piece for us just to reiterate, and this is specific to students in the testing protocol and those students in terms of how they go about initiating their testing, what that process is going to look like, and when they're going to receive that information. And I'll start the question. It's because it's important. In the course of the next few days, in the beginning of next week, all students, whether you're a commuter or residential student, will receive information about the testing protocol. And as we showed on a previous slide and talked about, that at that point, there'll be a process for you to sign up for your initial test, which will happen during the beginning of January. And that's the idea that you'll go in, you'll receive your test. That's when you'll go through the initial process of testing, which is an important process. It gets easier as we move through that. And then as you move over the course of the semester, you'll then continue to sign up for your weekly testing appointment. And that needs to continue. You can't skip weeks. You can't miss appointments. It's really important for us, for the safety of our whole community, that we continue to be very regular about, for those residential and commuter students, as well as our faculty and staff, to continue in the testing protocol. And detailed information is going to come out next week about that process, how to sign up, and it really connects back to the online tutorial that many of you already completed. And also just a final reminder, if you have not done that so far, the online tutorial, you must complete that before coming to campus. Essential that you complete that online tutorial, the Pride Pledge, and then next week you'll learn how to sign up for your testing for the spring semester. Our last question is for Kara, and I think this is an important one for us to talk about. As we move through the spring semester, there's going to be things that change. And what's our process and our plan for communicating things that we'll have to make decisions about in the spring, whether it be the plans for commencement, or the plans for we've talked about some potential things that may occur over the course of the spring semester. How will we communicate that? What's the working group doing to plan for those contingencies that if they may occur in the spring semester?
Well, that's right, Walt. We know so much more now than we knew in September about the disease. We will know so much more in March than we know now. And so our practice and our decisions will continue to evolve and change, and we will try to make the very best decisions possible with the most lead time possible for all of our students to appropriately plan. So what we have said multiple times today, and I'd like to continue to reiterate, is we always continue to publish very transparently on our website under the COVID-19 heading and our FAQs, all of our decisions around potential events, around pivots that we may need to take. I suggested one of the pivots earlier, Walt, when you asked me what would cause us to not be able to operate, or what would cause us to have to reduce residency, and that's significant community spread. And so if we were to see the potential for community spread or an uptick in cases, and we would need to pivot our testing protocol to perhaps twice a week, all of those decisions that are possible would always be published on our website. And we would continue with these types of town forums. But I would say that being nimble and understanding that what is true today may not be true tomorrow, and that we're doing our very best in a very fast-paced pandemic, that the criteria changes sometimes on a daily basis with the public health department as to our practice and protocol. The best resource you have, of course, are our FAQs and our website, and understanding that Regis will always make your health and safety, the health and safety of our faculty and staff, the priority in all of our decisions. We hope to have information sometime in February around graduation, and we certainly will publish that as soon as possible. Again, understanding that things really do change so frequently. One decision one day could be a different decision the next day.
Thanks, Kara. And that wraps up our town hall, but I want to hand it over to President Hayes for a quick closing and a goodbye. But I wanted to thank everyone in advance for your questions that you will submit from now on, but also want to thank you for your attendance tonight at the town hall. And please, as Kara mentioned, be on the lookout for further information, additional emails about our plan for the spring semester. So I'll hand it over to President Hayes.
Thanks, Walt, and thanks to all of you who participated in this. I kept calling it a webinar, but I think that's because I'm on so many Zoom webinars. But this Zoom meeting, our town hall, I again can only reiterate what all of us have said, is your health and safety is our priority, and you're being able to continue to progress in your majors. But we are so excited to have you back, and we have worked tirelessly to make sure we do everything the way it needs to be to successfully repopulate the campus and keep you safe during the course of the spring semester. So again, thanks for coming. Thank you, group, for all that you did to make this such a successful town hall. And I'd like to wish all of you a very Merry Christmas and a happy holiday season.